Intestinal ultrasound has really changed the game in monitoring my IBD patients. So this is a simple abdominal ultrasound and sonogram in clinic. So just show up. You don't need to be fasting. You don't need to take a bowel prep. You don't need sedation. Just show up in clinic. You could eat. You could not eat. It doesn't matter. So instead of the abdominal exam, where it's really not that beneficial in IBD unless you have a really bad problem, it really tells you how the disease is really going. And the nice thing is you're awake for the procedure. The family's actually in the room. And you're not waking up from endoscopy and you're kind of half awake. You're trying to tell the family member something. The patient tells me, complains I didn't talk to them, even though I did. They were, half asleep. And even though I have the printout and everything, they go home and kind of read it or not, and then we follow up in clinic, going, okay, so let's, we're going to go ahead and change your medical therapy. It's like, but why? I'm feeling okay today, etc. But in ultrasound, I actually have this one patient like this who I know she has active disease. I did her colonoscopy. There's inflammation. She's overall not feeling bad. So clinically, she's feeling okay. And I did the ultrasound another day, brought her back in. I keep telling her we need to advance your therapy. The simple mesalamine's not enough. And I scanned her and I showed her, she was there on the table, look, there's some bowel wall thickening, this is inflammation, this correlates to what we found on your colonoscopy, a month ago or whatever we did. She's like, oh, okay, but, still kind of hesitant. And then I turned on the Doppler signal, which kind of tells you blood flow to the area. And it was lighting up, flashing blue and red and blue. And she just looked and went, ooh, what's that flashing over there? I go, well, that's active inflammation. This is blood vessels feeding all that ulceration in your colon that we showed you earlier. This is active disease. And she looked at that black and red and blue flashing light. She goes, ooh, that looks bad. Now, what can I do to fix all these lights? And I go, well, I can fix those lights for you. Let's talk about those medicines we talked about last month and 2 months ago and 6 months ago. And she finally, based on flashing lights, said that, oh my gosh, that looks really bad. Okay, I'll do whatever you want me to. And I actually got her started on advanced therapy. And it was as simple as seeing in real life, in real time, when she's awake, not sedated or waking up from sedation, seeing something actively showing inflammation that really changed her mind. I was like, oh my gosh, this is like the best machine I've ever bought in this world to change someone's life, even though I've been trying to tell her over and over again. This is one example of doing something right then and there as point of care, showing my patient and letting her start therapy right away. And a lot of my family, I bring the family members. We can't bring family for the procedure, and colonoscopies, etc. But my family members are there. If I'm showing a patient thickened bowel or inflamed bowel, and the family members are right there, and I say, look, mom, dad, or spouse, hey, look at this. This is the area we need to work on treating. There's inflammation. Let's talk about the medications, risk benefits, et cetera, the whole shared decision making. And then I say, well, then we decide on a therapy. I'll bring them back and redo the scan, again, as a clinic visit, so no sedation, no prep, all that needed. And I'll see if actually it's improved, even if they're not clinically better or if they don't have any symptoms. We can actually visually see improvement within sometimes days to weeks later.